Welcome. This is the Human Services Committee meeting. It's Monday, August 1st, 2016, and it's about 6:13 in the evening. We have a quorum, and the first item on the agenda is approval of the meeting minutes of June 6th, 2016. Is there a motion to approve?
Move approval.
Second.
Okay. Any discussion? All those in favor say aye.
Aye.
Any opposed? Okay, so those are approved. The first item for consideration is police complaints review. Staff recommends acceptance of the Evanston Police Department complaints review from June and July 2016. It's for action. Is there a motion?
So moved.
Second.
Thank you. Didn't want to break into your dinner there, did no? Just teasing you. Okay, is there any discussion, any questions? Okay. Oh, I'm sorry, Alderman Miller?
Sergeant Wright, if you would. Quick question. So we have the list, and this is, I don't know if this is a separate item, but going to the end with the quarterly marijuana citation report. Just, I don't know if you want to discuss that now, or is that another portion of the agenda?
Yeah, it's
It's good. Okay.
Yeah.
So my question regards is, this report needs a little bit more information. It's kind of hard to tell what's going on with this. My concern is for pretextual stops. So if we've decriminalized marijuana in the city and a officer notices or smells or et cetera, someone using marijuana, and then they use the possible citation, or the possible stop to search for other things, that's a problem for me since we have essentially decriminalized it in the city. So if we could find more information regarding which ones of these stops, in a sense, were, so if there's a possession after a search for another crime, I think that's okay.
Yes.
If it was first, again, like just if it was seen as just a marijuana arrest or citation to begin with, and then something else came out of that, and then we just charged them with the marijuana arrest, that's a problem I have. So if we could have more information on that, I would appreciate that. Does that make sense?
Right, just in regards to the custodial arrest you're speaking of, correct?
Well, I mean,
Because we
we have the option. I mean, you can charge under the state statute or under our ordinance, right? And so this is, I mean, my problem is, so for example, there's state charge less than 10 grams. I assume, and this is, I'm just looking, for example, in my ward. I have three charges. It doesn't say if they're what we did with them. State charge less than 10 gram. If someone's dealing, that's kind of a different question. But if we have someone that just is charged under the state statute as opposed to our ordinance, where they could have just been under the ordinance, I'd rather have them under the ordinance. And if the stop led to them being charged with something more, I have a problem with that too, if that makes sense. Chief?
Good evening, Alderman. Thank you. Several things have changed just today.
Oh, okay.
The Governor Rauner, the law became effective today that anything under 10 grams is a civil procedure.
Right.
So that's state law. So right now, for 10 grams or less, there's not a state statute violation option available to the Evanston Police Department nor any other police department in Illinois any longer. I think that the questions that you have are interesting and difficult, and we will have to avail ourselves somewhat to Corporation Counsel because the complexity of what happens first, of when a car is searched, why it was searched, all those are a very individualized thing.
Right.
And so to preclude subsequent arrests because I've been doing this a while, walk up to a car, smell the odor of cannabis, search, we find a gun but no cannabis, or we find more cannabis than 10 grams. Or we find evidence of another crime, it's difficult to parse that out to see where that's going to go. And so it's almost a case-by-case review of those events. And so I think this becomes more of a policy matter, and I don't know from the data you have before you, which was developed for another reason and is incomplete, we can delve into these matters more deeply.
And that'd be great. And if you could look into it, and again, I understand these are all cases, and there's a variety of concerns in releasing information regarding pending cases, et cetera. But if there's a way we can actually look into this and look in the data and see if, again, if someone has a gun, for example, I don't want to stop them from being arrested based on, if they were smoking marijuana and that's how it was found. But I just would like to flush this out some more to see how we're actually using not anymore, it won't be the state ordinance anymore, our ordinance versus the state, et cetera, in terms of enforcement for marijuana citations and what that leads to. Does that make sense?
It does, and once again, I would like an opportunity to discuss at some point in time specifically what you want, because one of the issues is if we think we understand what you asked for tonight, we can develop a really complex set of responses that you may say, that's not what I wanted to know.
Sure.
And so I think if we need to refine the question a little bit, so, because one of the things we're always concerned about, Sergeant Wright does a good job preparing this report, but again, we're clearly not answering the question that you're asking. And so there continues to be confusion, so we really need to refine the scope of the question.
Sure.
And going forward, I hope that this report will be much shorter and much more specific, because once again, the 10-gram arrest option is off the table. It's citation only statewide.
Yeah. Okay, no, I appreciate that. And we'll clarify and figure that out as well. Thanks, Chief. Thanks, Sergeant.
Okay, Alderman Tindem and then Alderman Braithwaite.
Thank you. Chief,
Wait, just
hi, thank you. I'm trying to
I
equate
apologize, sorry.
this to alcohol use. And if someone is in the car, I know that they can be cited for having an open bottle within the premise of the interior of the car, correct? And
Generally true.
yeah, I mean, if you open the door and it reeks of alcohol, would you not continue to search, or what would be? I guess I'm just finding, like, if I was next to a car and I smelled marijuana, I would certainly feel like, they're driving under the influence, or someone in that car is using, and it's likely that the driver is it's not likely, but it's possible the driver is using as well. I mean, how is that any different than the use of alcohol and citing someone for having an open bottle in the car, or
In my opinion, in the eyes of the law, not that different. If we've established probable cause for a search, we've established probable cause for a search, whether it was we saw the open container, we saw the gun, we smelled marijuana, or we saw marijuana. All those give the officer a reason to expand the scope of the inquiry. And so is there an articulable reason that we've done what we've done? And so now I think, and once again, interpreting Alderman Miller's comments, a policy discussion of what the outcome should be of those searches, or what should be the administrative outcome of those searches, and are there any further restraints or curtailments on what the outcome of those searches should be? And so I think that this is a very complex question, because all these searches can be reviewed on the first base to see if we really establish probable cause. Do we have a reason, or were we guessing? And so all those matters are addressed in court. So it is the bar for us. Can we have an articulable suspicion why we took the next step for a search?
And I guess I'm wondering if you're driving under the influence, whether it's alcohol or marijuana. I mean, we can easily check for driving under the influence. There's a alcohol content, right? Blood content or blood level alcohol.
Much easier to check.
For marijuana,
it's a blood test.
It's a blood test. It's a blood test. Okay, so much more difficult. But if I guess I'm just very, very adamant that we don't allow people to drive under the influence of anything, whether it be alcohol or marijuana or any other kind of drug. And that's part of my concern.
And if you look at the experience in other jurisdictions, primarily Colorado, that have legalized it for recreational use, there's an explosion in emergency room visits and impaired driving events. And so it's something that we need to be mindful of and proceed cautiously with. And once again, at the same time, clearly keep the city council informed of what the results are, what has occurred. Thanks.
okay, Alderman Braithwaite and then Miller.
Thank you, Madam Chair. And so, just first, Chief, I want to say in all fairness to you, you and your staff have reached out to Alderman Miller and I, and we've just haven't been able to connect prior to this meeting to discuss this data. So I just want to share that first. I would agree with Alderman Miller that, at least for me, in what I was looking for, and I think the city manager can give you a good example of that, or Marty Lyons, when we look at this data, I'm interested in, and you've heard it from our residents, being able to look at these statistics, understand, in addition to when's the period, by the dates, so making sure that that's clear, The other thing that residents here, and you've sat in as many meetings as I have, the issue of breaking it down by ward, breaking it down by race, and being able to look at the percentages are very important, the same way you presented in your annual report. And so I don't know what your, Alderman Miller, if this is something that you want to look at over, whether it's on a monthly basis, a quarterly basis, whatever that time period is, but I can speak for the residents that I hear from, and probably that Alderman Holmes hears from as well. There is that perception that a large number, and again, I didn't count this up and do the math. I'll trust that you all can do it and bring it back to us, that we're always concerned about the number of black males that are being arrested for marijuana use, and also where is it happening. And I think that's a reality that we will always have to deal with while we live in Evanston. So when we see this again, to be able to break it down by ward, is it, west side, is it, in the north side, the perception is more arrests are taking place in the 2nd and 5th, where we have a larger black population, just be honest. And then looking at the age group, is it, 50-year-old men, or is it, teenagers under the age of 20? I like to be able to look at that. And then from there, it will at least help me to be able to share it with my residents. And then I think Alderman Miller being able to look at policies and other things, once we have data that's easier to read, then we can move forward. Very similar to how we were able to make the changes with the first round of ordinances, when we decriminalized it based on what we were seeing in the state and other cities. Is that helpful?
Somewhat, Alderman, but one of the things that we're really going to need to get to in these discussions are the issues that we're called into the neighborhood for.
Right.
In the statistics you have before you tonight are the individuals that were arrested in your ward for chronic sales. And so we're going to have to look closely at this, because the numbers don't always tell the tale. I mean, they're relevant. We need to look at them. We need to provide them. But the criminal justice system is based on fact patterns that we need to deal with. And also, too, the people who call us have a vote in how this turns out. Many of these many of these events were in response to calls for service. And so, and many of them were also officer initiated. But we need to go through that thoroughly and have a thorough understanding of what policy, if there's policy articulation by the city council, the ramifications of that articulation. And if I may, one of the things that occurred is one of the individuals who got rolled up for chronic sales was quite offended that he wasn't just given a C ticket. And they know the rules as well as we do. And so we're interrupting his business, and he figures this is going to be a business fine, and I'll be back in business in 20 minutes. And when it doesn't go that way, he's shocked and appalled that we've taken more aggressive enforcement.
Right. And I agree with what you're saying, but to make my point again, I would like to be able to, in a report like this, look at it by ward, by percentage, without having to do the math.
Okay.
Fair enough?
Yep.
And then
Sergeant Wright
it's-
is exceptional at math.
Okay. And then when we look at it, we'll be able to figure out where it's taking place. Is it more taking place on the west side of town, on the south side of town, North Evanston? And then I'll have a better, clearer picture of what you're presenting here.
Okay.
Okay, Alderman Miller.
And this discussion actually helped me out, Chief, to kind of clarify what I'd like to see. And Alderman Tendam, so my question is, when there was a marijuana use that gave probable cause to a search and led to a subsequent charge, that's kind of my concern. I see what you're saying with the individual that was selling, and I get that. And that's the hard part, is balancing between the two of that gentleman versus, the individual that was, smoking on their stoop and found other. I mean, I'm not even going to get into the specifics, but I'd like to see in this list, because, like, for example, if someone is driving under the influence of marijuana, the probable cause for the search is their erratic driving or other, specific behaviors that give rise to that charge, the DUI in that sense. I'd like to see in this report if there's what other charges these individuals were charged with, if that's possible. You can just, instead of getting into very specifics, just if this is marijuana possession by adult with, found a gun also or something to that effect, if there's a report of someone with a gun and we charge them with the marijuana as another part of it, that's great. But if we had someone that was, smoking, and then they also, were charged with something else because of the smoking, that's something I have a problem with. So if we can get into that, that'd be great. It's the probable cause shouldn't be the use of marijuana. That should be a ticket for the search. You shouldn't get This is my policy decision that I'd like to see is smoking in the city is like a traffic violation. It doesn't give you probable cause to search. That's my policy side of it. But I'd like to see what other charges are on here as well. If that makes sense.
It makes sense, but, and once again, I think we're treading up to some extremely difficult decisions on how you want the city policed and the latitude that we have. Because, and once again, a lot of searches start with the smell of marijuana. I agree with that, but I'm reluctant at this point to shut off our ability to continue that criminal investigation, because if I don't know if I smell marijuana, I don't know if I'm going to find 5 grams or 500.
One second. No, and I agree with you there, but I'd like to know that, if we are using this tool for more serious crimes, that we're using it for that purpose. And it's not just, it's a line. And we've made the decision, the council's made the decision that we wanted to, make it a citation versus a tool for searching. So I want to see that in the sense of wherever that line is, I want to make sure that we're not crossing it with the enforcement. And you're saying you don't want to shut off that enforcement mechanism, but I just want to make sure we're not crossing that line. And I'd just like more information just to make sure that's possible.
Yeah.
Okay, and once again, Alderman, in all candor, I'm having a really hard time discerning where you think the line is or where you want
I
it.
think what I hear, Alderman Miller, if I can, I hear him asking for the data. Like, I don't hear you making a judgment on the policy or stepping in. He's just asking for the data to be able to have an informed decision or thought process on which direction to go. So once we get the data and you're able to analyze it, then you can come back and dig deeper if you want to dig deeper, and then
Right. I'm not
it becomes
saying-
a policy issue. Yeah, we're
Right.
getting
If-
way
if-
ahead of ourselves
but
with
if-
what the
yeah.
chief is saying.
Right. And
Like, you're
if-
just asking for the information.
If looking at this information, and again, I don't know what that line is. I'm not trying to cut off enforcement mechanisms for you as well. But if it seems that we're not using this for proper enforcement, that's a question that's something we should examine as well. If
Madam Chair, members of the committee, I think we have the information we need. And so
you.
we'll come back. I don't know that we'll be able to be back at your next meeting, but certainly no later than your October meeting.
Okay.
So.
Can we,
Acceptable to everyone?
well, I'd ask, I think the number in terms of the statistics is very easy. I understand if you want additional information in terms of the rest, that may take time. But I would be very curious if you were to just break down these numbers in terms of percentages by ward, race, and age. I think that that's probably something, I could do that. And
Sure. But what I'm hearing, and I've not been a party to all
Right.
of these discussions directly, is you want to be able to tell the residents of Evanston that the police department of Evanston is not arresting people for smoking marijuana.
Well,
That's
Or
that
yeah, no.
that the
solely and completely, and that is the only reason for the arrest.
no, well, also that because if you are doing something that is a ticket, that's not leading to a more serious charge unjustifiably. That's it.
I think that is easy enough for us to come up with general categories for each of these and to check the box. I think Alderman Miller did a fine job of kind of walking through what your expectation was. Is this related to a traffic stop? Is it related to a gun charge? Is it related to something else? My sense is that's information easy enough to get. It will take us going back through each of these arrests to tick those particular boxes. So we can do the simple math
Thank you.
this evening. But I think the additional information that Alderman Miller is asking for will probably take
Yep.
us a little bit of time, because my sense is you just want to demonstrate to the community that we're not arresting people for smoking marijuana, and we're not arresting predominantly African-American people for smoking marijuana. We can absolutely demonstrate the circumstances. So I understand that. We'll all work on this, and we'll move forward.
Well, can I make the same recommendation for HH7? Because I had a similar difficult time comparing the data, especially when you have to read it. Sideways.
Can we wait until we get down to this
Yeah.
group of questions so we get through
Yeah,
our
fair enough.
our items for consideration rather than discussion? Is that all right with you, Alderman Miller? Okay.
Right.
No, I think we'll make them stay.
Oh, we're here. We're here for a while tonight.
Okay, so what's been moved and seconded is to accept the complaint reviews from the Police Department for June and July of 2016. All those in favor?
Aye.
Any opposed? Okay. So HH2 is the public access television. Staff is recommending that City Council authorize City Manager to transition public access television services, that's Channel 6, to the City of Evanston for operation, maintenance, and management. Staff is going to make a presentation, and then we will take citizen comment.
Good evening, Madam Chair and members of the committee. I'm Erica Storley, the Deputy City Manager. I'm just going to give a little history of where we came from and how we got to today. ECTV's been around for a long time. Many of you are familiar with their services, although they have changed over the past 4 or 5 years. They historically were funded through regular funding that we passed through from Comcast. That funding has been cut over the years as times have changed, media has changed, et cetera. They used to be operating out of a facility at Hartree. They now operate out of the service center across the street. They have a studio and a membership business model. Over the past few years, they've had some difficulty maintaining the studio and their facilities and paying their full-time employees to continue to operate the studio and provide videography services for both the city and District 65. So last year, if you recall, the beginning of 2015, we transitioned away from paying them to videotape our city council meetings, and District 65 took the same action. And since then, we have hired a full-time person for the city of Evanston to make sure that our videos are recorded here and then also at the district, and then we engaged in a revenue sharing or agreement with District 65 wherein they pay us a portion of the fees that are incurred for that full-time employee to render those services for the district. So far, so good. It's been going on for 1.5 years now, and we have not had any issues. It's nice to have that stability that we didn't have for a while there with the turmoil that ECTV was facing with staff turnover and budget cuts and things like that. But much respect to the members of ECTV. They've tried valiantly to put forth a business model that would provide them with a regular stream of income. It's very challenging to do that in the days that we're in because the way that media has changed. And so instead of doing the videography and also operating the public access since 2015 January, they've only been doing the public access portion of the services for the city. And in lieu of that, they rent the studio to them for $1 a year, and they get full use of it to try to make a go of the business model. But where we find ourselves today is that they're having still extreme difficulty in getting enough revenue to fund their operations and fund their staff. So they've cut back to some smaller number of hours this summer. They've augmented with volunteers who can open up the studio, and they've made many appointments on an as-needed basis versus just having these open studio hours. So we felt that this was a prudent time to make a business decision that would transition these services back over to the city so that we can ensure that the city has access to the studio and we can maintain a set of operating hours and a set of equipment that is going to be useful to the community and is going to help them do what they want to do in the public access sphere. Many public access stations have closed throughout the state over the past decade. There's still about 34 operating. We would really like to continue to operate this, and we think that the city can do a solid job of making sure that the community has access to quality services and equipment and can do what they want to do for public access programming. I think that the business model of ECTV has had to focus on revenue so much that they have not been able to devote the time that's necessary to cultivate the community with what they need insofar as education around public access programming. So a lot of the businesses that ECTV has had to do to sustain themselves is more in line with music production and things like that. So we've had some bumps in the road, but like I said, I really have a lot of respect for all of the people that have been trying hard to make go of this. I just feel like at this time it's probably in the best interest of the community that the city handle this operation in much the same way we've been doing the videography services for the past 1.5 years. So I would be happy to take any questions, or you can go ahead and do citizen comment.
Okay, thank you very much. Before we go to questions, let's go to citizen comment. There are 2 people who have signed up, Michael Petrosius and Cindy Court.
I'm Michael Petrosius. I'm actually one of the board members of Evans Community Television. Honestly, I'm here. I'm listening to Erica talk. Actually, Erica told me maybe a month ago that the city wasn't actually wanting to take over the station, that they were actually happy with the direction we were headed in. I've never been one with production services. I've actually been focused on making sure that the station is back into the community. One of the things I have done is we're in post-production, that we have a small grant from the Arts Council about local artists in the city of Evanston that we're finishing up editing that will be airing. We're highlighting about 10 artists, including stuff at the Arts Center. I've also been part of outreach. We've partnered with the Evanston Arts Center to offer classes. We have 2 classes going on right now, actually, intro to script writing, which I teach for free. I give them my time on Thursdays to go and do that. And we also have a small class of about 6 students who are taking production editing, and they're mostly kids. There's actually a parent and a kid taking the class together. And we've actually outreached beyond Evanston. We have one of the kids actually taking the classes from the South Loop, so that they're willing to come up to Evanston to take these classes, I think is something amazing that we have done for the station and for the city of Evanston. I am out there. I'm trying to work with the chair of the drama department at District 65 to bring more access for the students. They did a whole program in which they did a live play thing, and I was kind of like, hey, why not talk about doing some kind of acting? We can teach kids script writing, we can teach kids production editing, and we can also, because acting on camera is a completely different animal than stage, we can also offer you some, that kind of, work. We can figure that out. We can work out a budget. If we have to, we can figure out, I'm sorry, grants. I get nervous speaking in public. I'm really sorry. So I'm kind of, the business model, yeah, it's hard to turn it around. It's a non-for-profit. We're not a theater group like Piven, or Piccolo, where we can sell tickets. We have to try and build up our viewership again, and that's what we've been trying to do. That's what I've been trying to do, to be out there. Getting out in the community. The last thing I filmed for the community was the food truck festival that was aired, and I believe we had almost 200 views for that video alone, just circulating it. And Alderman Rainey seemed happy with it. I've also, with the class that we've made, it's small. It's a small start. We're just starting that up. We've made about $2,000 in the class fees alone. So I feel at this point that the city seems, like with the city manager coming and saying, well, we want to take it over now. It's basically kicking us while we're just starting to get up. We're just finally getting there. It's going to take, it takes a while. And we even were told that by Erica Storley, that, like I said, I might have already mentioned that she said she liked the direction we were going. She knew that it was going to take time. She even mentioned that she was going to try and get us about $10,000 in funding, which I didn't need. I was okay. We can run this as a volunteer organization. The South Branch of the library did it for years, where it was, it was just, I forgot what they used to call it. But now they got it back up to being, it was a full library that they were running as volunteers. And we can do that. We can be there, I think, more than what a city can be. Just one, they're telling you that there's no additional cost. We can be there for a member if they need to be there on a Sunday and check out equipment. We can sit there and say, yeah, I'll be there. I don't think a city employee will do that. We can, my background is in production and writing. That's what I graduated from. I've actually won a local Emmy for some of my work. I can be there to help other members with their productions, and I'm not sure how much time a city employee would have for that, whereas in a volunteer run, which ECTV would be, is there for the community. We are, that I'm part of this community. I live here. I love this city. That, I used to live by Midway and wonder who would live up here. This is awful. The streets aren't numbered. But I've fallen, we moved here 10 years, and this is just the most wonderful city, that we just love it. And I'm probably rambling now. I'm sorry. It's just, I put a lot of work and energy into this, and I've really done, I think we've done an anti-bullying video for children who, we're still working with them on that, where they were able to come to me, and I said, yeah, we'll put that together. I don't know if a city member would do that.
Okay.
I'm sorry, there's just.
Michael, can we wrap it up now?
Yeah,
Okay.
I know, it's just, we have the ability to do it. Please don't kick us while we're down. At least table this and let us come back and show you what we're really doing. Give me more than 3 minutes.
Okay.
Thanks.
Okay, Cindy? Okay, and Is there anyone else who wanted to sign up for citizen comment here and hasn't? Okay. Yeah.
Hello,
Hi.
I'm Cindy Court. I'm the Vice President of ECTV. I'm a longtime member, probably the person with the most historical view of ECTV. When I joined in 1983, the cable company was Cablevision, and we were just public access. The Yellow Studio, or local origination, was managed by Cablevision. They left, and we stayed. Then we became a nonprofit in 1986, which I helped work on. Then we became Evanston Community Television Corporation. Then in 1992, we took over managing District 65 and the city's cablecast. We became Evanston Community Media Center. There was a cable commission back then. We received the PEG money for equipment, and then we also received money from the franchise fees, which ran the station. The city of Evanston still gets over $1 million from the current cable company, Comcast. Yes, we have received a space for the community to take classes, edit, check cameras in and out. We built a studio with all the money we saved over the years. We built it. We put a lot of time and community building into ECTV. We have run ECTV without any funding from the PEG money or money from the city that the city receives from Comcast. I don't know if you still call it the franchise fee. With all due respect, that's citizens' money. It should go to ECTV, where we have worked hard to keep it alive. We have held training classes, held fundraisers, volunteered for video shoots and productions. Yes, we reduced our staff, but our members and our board members, we're all coming in on our own time, and we are helping run the station, and it's running well. We're letting people, make appointments, come in when they need to come in. We've been working on Evanston's Big Break that the mayor has sanctioned. It's a big fundraiser. I worked on Evanston Idol, and Vanda was one of our winners. It was a big production I produced. For the love of our vision, our mission, our commitment to free speech, to give everyone a voice and specialized care, we request to continue our vision and keep public access in the hands of the citizens, ECTV, the residents of Evanston. The specialized care, training, and personalized attention we give each member is more important than just checking equipment in and out. The city doesn't really have a plan or the personalized touch that we can give them. Thank you for your time.
Thank you very much. Jeff Berkowitz, and that'll be our final speaker.
My name is Jeff Berkowitz, member of ECTV, Evanston resident. I have been producing a TV show for the last 18 years called Public Affairs, a weekly half-hour TV show. Some of our more notable guests, Barack Obama 6 times when he was a little less well-known, 2000 to 2004. Congresswoman Schakowsky, State Representative Julie Amos when she was the rep from this area, and almost 900 other city, county, state, federal politicians. For 16 years, I was doing that show out of Comcast Skokie, Comcast Winnetka, when I lived in those areas. For the last 2 years, been producing out of ECTV. We air in Chicago, in Rockford, Evanston, 34 Chicago metro suburbs, and we're essentially syndicated community access, public access. So my interest, and I think many others in Evanston, want to see the cablecast channel continue to function well for your school, for your village, and for public access meetings, and to see the studio and equipment function well. In my view, the best way to accomplish that would be to have Anderson Castillo, who I haven't talked to about this, have not. But I've known Anderson when he was at ECTV, as many of you know, before he was here. I know him, what he's been doing here somewhat in the city. I think something like that's necessary, that he be in charge of oversight management in terms of the studio, in terms of the cablecast channel, in terms of the equipment. And I think those who want to use community access, public access in Evanston would be best served by that kind of a cooperative relationship. But I think you need somebody professional, as Anderson is, conscientious, and who understands the studio, the equipment, the channel. I also think one thing you might strive for, I was talking to Alderman Miller just briefly before the show, is to have some kind of perhaps cooperation between Chicago and Evanston. As some of you may know, Chicago has a $2 million community access operation, somewhat larger than here. It's been going for decades, ongoing. I've been airing out of CAN TV, which is their operation, Chicago Access Network TV, for the last 18 years. But we can't, as an Evanston resident, I don't have access to their studio. If you could work out something like that for Evanston, where they'd have access to the Evanston studio, not just for me, but for any other, I think that would be helpful. And I understand the city works with Evanston on a number of arrangements here. You know, Howard Street's the dividing line, so police and people, I live probably a half a mile south of the city. And CAN TV just moved into a new facility, a new building all of their own, from Greektown to 1309 South Wood, which is in the medical district, I believe, near near the Polk Street line, Polk Street Pink line.
Mr. Berkowitz, could we
wrap up?
Yes, please.
So that's just, in short and summary, I think Anderson is key to having that operation maintained in a high quality. I think you should strive for some kind of Chicago and Evanston cooperation, collaboration, perhaps giving Evanston residents access to the studio. And if you have any questions, I'd be happy to answer them.
Thank you very much. Okay, so that closes citizen comment for tonight. So we have a motion and a second. Did we do that? We didn't do that. Okay. So I would need a motion to authorize the city manager to transition public access television services, Channel 6, to the city of Evanston for operation, maintenance, and management. Is there a motion? Is there a second? Okay. And discussion. Anyone have any? Alderman Miller.
Erica, in talking with Mr. Berkowitz, I think it brings up a good opportunity that we have. Can we check with, like, for example, we're talking CAN TV or other public access stations around to see if we can have an agreement with them to have Evanston residents to be able to use their facilities? I think that the big question is there's some demand for access, and if we can find a way that, you know, the city doesn't necessarily have to provide access to our station, but we have access to other stations, I think that might kind of smooth over this transition as well. So if we could look into that, I think that'd be a good compromise between the two.
I agree, Alderman Miller. I think that there's, excuse me, a few different opportunities to explore if the city were to take over operation of this. In the past, it really hasn't been our foray, so we haven't gotten into it, but I've received numerous calls from individuals in the community who are interested in helping out, partnering, doing some different things. And then I think exploring what other communities are doing and trying to leverage that so that there's some synergy between Chicago, Evanston, and the other remaining public access stations, I think that could be really beneficial to the community, so we would certainly explore it.
And I think the key part is having access to production facilities. So if we can some way figure out a way to have our residents have access, if there's any interest, if we can have an intergovernmental agreement with the city, if they're, I don't know what the structure of CAN TV is. I think it's an independent nonprofit. I don't know if they have some relations with the city of Chicago, et cetera. But if there's a way we can work out access, I think that'd be beneficial.
Absolutely.
Okay, Alderman Ravel.
I'm pretty new to this whole subject, so I have some kind of basic questions. So would we not be able to have people coming into our city facility to do productions and things like that? What actually happens?
No, what we're proposing is that the city would operate the public access station. So currently, ECTV is in charge of that, which means that they schedule all the television shows that are produced and make sure that programs that are being made are put on the air. But the city would then take over that, as we do with the government channel and with the education channel. So the gentleman that Mr. Berkowitz spoke of, Anderson, he is our staff person. He is the one that is in charge of both the Channel 16 and Channel 19. So he schedules all the programming and does all of the work that goes into making the channel run. So in a sense, we would transition Channel 6 over as well. He would handle the maintenance and filing of the shows, scheduling, all of that. And then we would continue to operate the studio and allow for the public to come in and utilize it to make shows to put on the station.
And so would there be a role, though, for the volunteers who've been so active with ECTV to?
Absolutely. I've been in touch with several of the volunteers, some of which are not here tonight, the ECTV president, a couple other members of their board. They have expressed enthusiasm about working with us if this were to happen tonight in a capacity other than what they're currently involved in. So we have given people volunteer city badges so that they can go over there whenever they need to. I think volunteers are an integral part of how we move this forward because, like was stated earlier, one staff person wouldn't be able to do it all. This is a community effort, and when volunteers are able to work with other people in the community who want to do this, then everybody wins. So I think that we would not diminish any of the current capabilities. We would only seek to enhance them in partnership with volunteers and other partners in the community and outside the community.
No. No, the public comment part is closed.
And one more little sort of technical question. So with the help of volunteers, then we'd be able to keep the studio open, let's say on weekends, for people to come in and do programming, or would it have to have city hours?
No, I mean, the studio is open on the weekends right now with the volunteers that are currently volunteering for ECTV. So I don't know that would change at all. I mean, like I said, our intention is not to take away any services that are currently existing. It is only to enhance them.
Okay, anyone else? Okay, then we'll call for a vote on it. All those in favor, say aye. Aye. Any opposed? Okay, thank you very much. Next, sorry, the next didn't have that on. The next item is HH3. It's the 2016 Emergency Solutions Grant recommendation. The Housing and Homelessness Commission and staff recommend approval of the 2016 Emergency Solutions Grant, ESG, allocations totaling $144,459. That's $133,625 to two social service agencies, Connections for the Homeless and the YWCA Evanston North Shore, that provide housing and services for individuals and families who are homeless or at risk of homelessness, and $10,834 to the City of Evanston for grant administration. Okay, any comment? All right, all those in favor say aye. Aye. Any opposed? Okay, now we're moving on to our items for discussion, and Evanda, I guess I'm going to turn this over to you. We've done a little bit of the last two. Yeah. Sure. Sorry.
Good evening, Madam Chair and Human Services members. Tonight we have several items for discussion. The first item is Presence Crisis Intervention presentation. With the significant amount of decrease across the state, including in Evanston, of mental health services in terms of crisis intervention, I thought it would be important to give this committee an update of a contractual relationship that we do have with Presence. We've had this contractual relationship with Presence Behavioral Health Services for about 3 years, and we've seen a significant increase in the services that they do provide. And Cindy Castro is here tonight representing Presence Behavioral Health to share with you in a literal sense the types of services that are provided, really reminding us of what crisis intervention and outreach looks like in terms of the services that they provide to the City of Evanston. Cindy?
Good evening. Thank you for having us. So my name is Cindy Castro. I'm actually the manager at the Outpatient Behavioral Health Clinic located at St. Francis Hospital. So Presence Behavioral Health has developed this great relationship with the city of Evanston, and it's really to address what we have identified as these frequent flyers, which means those that are frequently calling the police, getting transported to the hospital, and sometimes within hours get discharged with maybe no true follow-up of services or a scheduled appointment. So that's where we come in. We get our referrals directly from the victim's advocate workers from the police department. And these are ones that they've identified as chronic. Chronic might mean 2 consecutive reports or 2 reports within a 12-month period. These cases vary in terms of reasons for the referral. It might be some aggressive behavior, suicidal ideation, non-compliant with medication. So just kind of different array of diagnosis that the client has trouble with. So what we do is we get the report, then we outreach either via phone. After maybe 3 attempts, if there's no success with the phone, then we do the home visit, just to really try to engage. Because these are very severe chronic individuals, it takes several attempts to really try to even get an answered call or a door. I mean, we've had plenty of times when we go to the home and doors have been slammed in our face saying, no, we do not need your services. I mean, people telling us from their window, I'm okay. But then we keep getting reports, so we keep insisting as much as we can to really try to engage these individuals. So like I said, it's really multiple attempts with home visits. This doesn't happen overnight. We wish we were miracle workers and had a magic wand to make all these, their difficulties really go away. But it's not the reality. And the reality is that it takes a lot of hard work and dedication to be able to really engage these individuals. So when we follow up with some of these individuals, we do find that some of them are already linked to services. So we just make sure that they're continuing with that service provider, have a scheduled appointment, or really following up with the services that they have. Because we're not here to take them off for our agency to do, because we can't do it all. So we really try to collaborate as much as we can with the different resources available already in Evanston. But when they are not linked to services, then we try to bring them to our office. Sometimes it takes a while when they actually present to our office. We're consistently going to their house because that's where they feel safe. So we have found that the success has been where we're going to them. We're not expecting them to come to our office. We're either meeting them in their home, a public place, or because we have expanded these services to the public library, we do offer kind of open hours at the library during the fall, winter, and the spring, where we have interns once a week for about 3 hours at the library in case anything happens, any crisis, intervention, de-escalation, support for the staff there that are not clinically trained. So as we all know, the library is a warming shelter for a lot of homeless individuals, or really just a public place for individuals to go. But in the midst of them being at the library, it might be an interaction with another patron where they're invading each other's space while they're using the computer, so they get a little upset. So then that's why, if we're there, then we are hands-on with our security to try to make sure that we're de-escalating them and providing as much support. We have what we call our regulars at the library, because they will never come to our office, but faithfully, if I'm there every Friday, I have somebody there that I've seen every Friday, because it's very unofficial, and it's not part of what is the kind of a stigma with mental health, so they don't want to come to our office, but I see them all the time at the library. And the staff have expressed how they feel comfortable that we're there to help out as much as we can. Along with those services, we do have a 24-hour crisis line where it's a live person picking up the phone, and anybody can call the crisis line. So we've gotten referrals from actually different professionals in the city that call our crisis line, because it might be that they're trying to call me, but I'm in a session with the client, so I can't answer right away. So then they call our crisis line, identify the client or whatever situation is going on. Then they try to get a hold of me any way that they can, and then we sometimes sometimes respond within minutes. An example would be where Audrey Thompson has called the crisis line, and she identified a client that was actually in her office, and I want to say within minutes, I responded to that call, and the client was still there, and within maybe half an hour, that client was actually in our office for an assessment. So this is just the immediate response that we try to offer in order to engage clients in any type of services. So at the beginning, it might just be support with the hopes of really connecting them with what is that they need. So we've also done where at the General Assistance Office, we're physically present in case they need any assistance. If they have identified a resident that they know that hasn't been doing so well and really needs some intervention, so they'll call us and say, this person will be here Thursday at 2 o'clock, can you make it? I will try my best to make it there. If not, I send somebody else. And this is really just to have that face-to-face contact. And once again, this is what we have found that it's successful, that we're meeting them there. We're meeting them anywhere that they're at in order to at least start the process. And then I'll present a case a little bit to kind of give you guys an overall idea of what we deal with. So we're going to call this client Joe. So Joe he was referred to us in 2015. And he had multiple reports. So in 2015, it's been about 15 plus reports. Now we're down 2016 to about 6. This required a lot of time. This person is very delusional, harassing people in Evanston in public places. Didn't want our services at the beginning, but we kept insisting and finally brought him in, supported the family. Family was not accepting of the mental illness and really thought he's okay. He doesn't need any services. We finally, a success would be where 2 months ago, after a year working with him, 2 months ago, we actually hospitalized him. It was a team effort where the Victims Advocate Department was calling me, letting me know what the situation was. This is my first time meeting him after another staff have been working with them. And within maybe 15 minutes, we had the mom at the house saying that she was providing groceries, but really she was there with backup to be able to transport this person to the ER. Within 15, 20 minutes, they were actually, I can see them from my wonderful view of the emergency room from my office. I saw client show up, ran down to the ER, was able to talk to the crisis worker, petition him in. And for us, it's a success because we got immediate services. He was able to be hospitalized for 3 weeks and residential for 2 weeks. He's now discharged, following up with more services, and sometimes it's once or twice a week that I see him, but mom's calling me almost every day. And let me not forget to mention that we don't take his insurance. We're not credentialed through it, but with the partnership with the City of Evanston, we're able to provide above and beyond what these clients need with not having to not worry about the coverage, especially right now with the insurances all over the place where they don't cover everything. So that's just really one of the many cases that we have. They're very severe, chronic individuals that need a lot of time, and we just hope that we can continue this collaboration and help as much as we can with the city, because we have found that over the years, you guys have the metrics where even from 2015 to 2016, our numbers have increased since the beginning of this partnership, and we have really found that it's been a success for a lot of the residents, especially because we've identified certain chronic ones where we follow them until we're able to kind of help them out as much as we can. So I'll take any questions. I'm not sure if...
Alderman Miller and then Braithwaite.
Hi, Cindy. Thanks for this. Just looking at the numbers, it looks like in the first 6 months of the year, we had 190, give or take, 187 new cases. Is that correct?
For the first quarter, you mean, or?
And second. I mean, 187, looking at the cumulative total, right?
Yes. So far, up until June.
Can you, why that's a monster increase? I mean, continuing cases, we have 14 for the year. These are kind of the people you've seen, over time. You're saying that the multiple, what's going on with the 190, give or take?
Because these are encounters. It might be unsuccessful attempts or successful attempts. So it's really, because it takes multiple times, sometimes we've worked with people for a year or over a year to try to really engage. So these are encounters, so meaning contact by phone or a home visit, and sometimes it's a couple of visits a week to try to provide the services.
So what's the difference between new and continuing? I'm looking at this individual served, it says new 190. So I mean, are these multiple attempts for the same person in some of these cases?
Yeah, we consider them new because it's still, even though it's an ongoing, we don't calculate it that way. It's more of like this was a new interaction with them because on a daily basis it's maybe something different that we're addressing.
So how many unique people are you involved with, would you say? Like, I know it's different numbers of contacts with each individual, but just guesstimate your caseload.
Oh my God, my caseload would be about maybe 25 or so, and these are.
But you're seeing these 25 people are taking up, again, 208 different interactions with you. So you're seeing, yeah, okay.
Yes, that's about right.
Yeah.
My question too is, so I mean, and maybe this, Sarah, if you could possibly help out with this as well. Sorry, this is funded above and beyond our normal mental health allocation. Is that correct? So we aren't providing with these 25 individuals. You're connecting them to services, but we aren't providing any direct service to these individuals, right? Otherwise, it's case management. It's trying to find people with services. Is that right?
No, she.
Sarah Flax, Housing and Grants Administrator. To the best of my knowledge, the city is not providing duplicate services at all to these clients. However, Presence is referring them to other providers for services at times.
Yeah, depending on their needs.
Right.
Yeah.
No, it's more you're just trying to connect them and keep them going back to services. Is that right?
So we're doing case management. We're doing, crisis intervention. We're doing actually individual therapy and family therapy.
You are doing therapy.
Oh yeah, we're doing it all. So that's why it's 187 because this is 187 encounters. The encounter might be, like I said, a home visit, family therapy, individual therapy. Just to.
I can imagine these individuals would need a lot of therapy or a lot of treatment in regards. So are you getting, would more resources be beneficial to helping these individuals, would you say?
Oh, definitely.
Okay, from the city as well?
Yes.
So,
because it's, originally when we first started, and this is our 4th year, it was for a part-time therapist, and now it's taking up more than half of our time because of the intensity of them.
Right. I just, not in this meeting, for my colleagues, we have a discussion of the mental health board at the next meeting scheduled tonight. So I think this is something we have to consider as well. As Presence is doing, is seeing our most difficult cases in the city, and the question is, are we actually meeting that demand in terms of the allocation of our resources in terms of mental health allocation? So I just want to I appreciate you coming tonight to discuss this because it's something we have to consider as well. Is these 25 individuals that are taking significant resources, are we doing the best possible way, of providing services to individuals, or can we do more? And possibly, I think the savings in the back end would be great too, with police and fire and ambulance.
And what we have noticed from the ones that we actually successfully engaged, they're using us instead of calling the police or instead of going to the ER and then getting discharged right away. Now they're calling our crisis line. So if you notice a crisis line calls, they've increased because now they're calling our crisis line, and then we just follow up. So it's really somebody just providing that support. So they just need somebody to talk to at 2 a.m. because they can't sleep, so we're providing that service as well.
I hope you're not providing that service at 2 a.m. yourself.
I'm not. I can't do it all. I wish I could.
Yeah.
Alderman Brinkley?
Thank you, Alderman Fisk. And so thank you to you in Presence for Alderman Miller, Alderman Ravel. I remember a couple of years ago when we had this discussion, and Director Thomas Smith was very instrumental in bringing this organization to the city and the services. And part of my concern at the time, particularly for community of colors, when it comes to mental health issues, we are very slow to address that and seek that type of help and services. So I thought at the time it was very important to make sure that there's a diverse staff and making sure that, in making the connection. And so it has been my experience with one particular resident who the family was going through a very difficult situation, that your follow-up was very, very crucial in terms of getting her services. So I just want to say thank you to you and your organization on behalf of the family. And one of the things that I'm seeing now in my ward is, particularly with the state cuts and residents who are not receiving their medications, they're now going to street pharmacies in order to treat the issues that they're dealing with. And so I have a number of families who not only are they dealing with a mental illness, but now they're dealing with a mental illness coupled with the substance abuse. So I don't know if you're seeing a trend in that, but it's something that at least that I'm seeing in my ward, and I would love to know what type of services do you have to offer specifically for that issue, and then how can I follow up with you after the meeting?
We do have a substance abuse clinician at our site that does any substance abuse group or individual therapy and stuff like that, so we'll be able to help out as much as we can.
And are you seeing an increased trend in that with?
I think sometimes it depends on the season.
Okay.
Sometimes there's peak, in the summer, you see more of a peak.
Okay.
So really it varies.
Okay.
Thank you, Cindy.
Thank you.
Our next presentation is Hoarding in Evanston, and that presentation is going to be given by Indira Perkins, our Human Services Manager, and Ike Akinga Agbo, our Public Health Manager. Go up the slideshow.
F7, isn't that command? You hit F7.
Slideshow.
Yep, there it is.
Good evening, Madam Chair, members of the Human Services Committee. My name again is Indira Perkins. I am the Human Services Manager in the Health and Human Services Department.
And I'm Ike Obo, Public Health Manager.
And we wanted to give a brief presentation on hoarding in Evanston, as it has become an alarming issue for our department.
Let's see. Oops.
Okay. So we'll start with just a brief definition of exactly what is hoarding. So hoarding is a persistent difficulty discarding or parting with possessions regardless of their actual value. There usually is a mental component to this behavior. The city currently responds to housing and hoarding issues when there is excessive clutter, blocking egress and ingress, clutter causing injuries and fatalities, which luckily we have not seen in Evanston, rodent, insect infestations, odor, no working utilities such as electricity, water, and structures that are in disrepair. What you see here is a clutter image rating that was developed by UCLA. This was actually given to us by a group of Northwestern students who we recently partnered with. They have a analytics class for social good, and they did some research for us, and this is one of the clutter image rating tools that our staff currently uses when they go out and respond to cases of hoarding.
And usually when we do respond, we usually find the last 3 boxes there, 7, 8, and 9, and that's usually what we find the conditions that our residents are living in. So how do we respond? We get the complaints through emails, through 311, and when we get these complaints, we go out, our property maintenance inspectors or our environmental health practitioners, they go out, they team up with a human service specialist who will render resources or services for people who need it, like the elderly, or if we perceive some mental health components, it's the human service specialist who will help to try to assist with resources and services. And we also conduct an inspection as well of the property, and we try as much as possible to work with these individuals knowing their conditions to correct those violations.
So some of our challenges are mental health conditions. Oftentimes when we locate these residents, they're often alone. They do not engage in society and they do not want to be bothered. Sometimes there is a dual diagnosis of hoarding, which has recently been added to the DSM module, as well as some depression, maybe a bipolar disorder or schizophrenia. We also have some trouble gaining access into the homes if the property is owner occupied. If it's a rental unit, we have easier access, but again, if it's owner occupied, we do have troubles there getting inside. There is some lack of cooperation from the residents. They feel like, they should be able to live in any condition that they feel, as long as they're not bothering anyone. But again, when we start to have egress and complaints from different neighbors and condo association members, then we know that we need to step in and try and offer some assistance. The cost of cleanup can be very, very costly, often in the $20,000, $30,000, $50,000 range. Sometimes there can be a lack of resources to address the cost of cleanup. Some of the residents can't afford the cleanup. And then the maintenance after the cleanup, sometimes we'll go in and we'll work with the resident and then we'll clean up, and then a year later, the situation is back to where we started. So some of our collaborations and partnerships, again, we have partnered with Northwestern University's Analytics for Social Good. They did do some data mapping for us and kind of identified areas where we see an increase in hoarding. We also have established a North Shore Hoarding Task Force. We meet monthly. This is with Evanston, Skokie, and Niles. We recently had a educational forum last week that was held at the public library, where residents and property owners could come and get information in regards to hoarding, get their questions answered. It was very, very informative. We plan on having another session of this in the fall. We also partner with Presence Health. Cindy, who was just here, is wonderful. She goes out with our staff to try and engage and offer the residents services. And Housing Options as well can offer some additional mental health services. So our next steps are, of course, continue collaboration with our community partners, more education to the community and property owners, continued research on best practices as it relates to hoarding, and teamwork with our other city departments, which include Parks and Rec, Police, and Fire. So we'll be happy to answer any questions.
I have one. Why is the cost of cleanup so high?
A lot of times there is structural damage. There's damage to the utilities. There's lots of egress. It can be quite costly.
Alderman Ravel?
So you mentioned that we are seeing quite a few more of these cases. So how many are we talking about here?
Currently, our department is addressing 6 cases that we know of. Mm-hmm. We feel that there are a lot of cases that are undiscovered in Evanston.
Mm-hmm.
Any other questions?
Thank you very much.
Thank you.
Thank you. And our next presentation will be the point of dispensing presentation. We are required receiving grant dollars for public health emergency preparedness to conduct regional drills, communication drills, and point of distribution of medications. And Elizabeth Lassiter, our emergency response coordinator, is going to quickly walk us through our point of dispensing exercise and do a summarization so you know how staff have participated and honored the requirement by the state to conduct this exercise.
Good evening, Madam Chair, members of the committee. I'm Elizabeth Lassiter, Emergency Response Coordinator with the Health and Human Services Department. And as Director Thomas Smith just mentioned, I'll be giving you some information tonight about recent activities with the Public Health Emergency Preparedness Program. We'll see if I can figure out the mouse here. Okay. So Yvonne already mentioned that we received 2 grants from the federal government. They're filtered down through the Illinois Department of Public Health. And the purpose of these two grants is really to mitigate, prepare, respond, and recover to public health emergencies. I've listed several on there that are kind of the classic public health emergencies that we need to prepare for. So that's things like bioterrorism, pandemic flu, and other infectious disease outbreaks. Although these grants, we feel like, also has helped us prepare for other emergencies that might have a health component. And we also think that they help us because of some common requirements like the incident command system training, which provide us with a common language for all responders in our planning and coordination. So the items that I have listed here are some of our requirements for our grants, and they're things that the grants support. So situational awareness, so things like keeping up on Zika, what's going on out there, some of the research, training staff and volunteers, improving our written plans or developing new ones as new threats emerge, creating tools for response and recovery, resources for our staff or volunteers in an emergency, maintaining and creating partnerships, and then conducting exercises. That's what I want to tell you a little bit more about here. So exercises are ways for us to test our plans and coordinate with partners with the goal of then improving our plans for the future. They can be discussion-based, or we kind of sit around, talk about a hypothetical scenario, and say what each of the partners would do. Or they can be operations-based, which is where we're actually going out, we're deploying staff and equipment, and we're practicing in as realistic of a scenario as possible the emergency and our response. Some of the partners that I have listed here are our regular partners that we practice with for emergency preparedness responses. So of course the hospitals, other health departments, Northwestern, and our volunteer groups, CERT and the Medical Reserve Corps. Very recently, we had one of these exercises. So it was June 14th and 15th of this year. This was a statewide full-scale exercise where we actually went out, we deployed staff and resources, and we tried to simulate a real environment where we could see how people would respond like they would in a real event. This was required, as Ivana mentioned, for one of our grants for us to participate here. And the state health department, they set the dates, the scenario, and the scale. So you can see on here, they chose for us to practice an intentional release of weapons-grade anthrax in the Chicago region, something very cheery to think about. But if that were to happen, the Health and Human Services Department is required to have a plan to dispense antibiotics to every resident in Evanston within 48 hours to prevent inhalation anthrax. And you can see here our city planning team. So it involved almost all of the departments from planning and execution. So we had fire, police, parks and rec, city manager's office, and public works. And we could not have had such a successful exercise without these members. So in our attempt to have it to be like a real event, we wanted to test a lot of things, in a way that we felt that they would happen in a real emergency. So we got notification from the state. We simulated then a notification to our staff and volunteers. Some of our other goals for the exercise were to set up our point of dispensing or our emergency clinic where people would get their medications. We picked up supplies from Cook County. And then we also conducted a dispensing operation where we had over 200 people come through and get their medications to keep them healthy. So here are just a couple pictures from the event. So this is June 15th. This is our pod, our point of dispensing, where we had clients coming through. They're lined up here. Everyone in a vest is a pod staff person, so they're trying to assist the people who are coming through. This is the entry station here, so people are being greeted, directed, making sure that they're not ill as well so that they can remain on site and get their medication. They were then directed to the registration table here. They check in, get their paperwork so they could complete that. Their paperwork would have information on there about drug allergies, current medications, brief medical questionnaire. There's, I think, 6 questions on there. And then they would take that form for themselves and their family members to the screening station, and someone would determine which medication is most appropriate for them based on how they answered the questionnaire. Then they would take that form with them, wait in another line, and then go to the dispensing station here. And that's where they would actually get those vials and some information and be directed to the exit. So we do have some results already from the exercise. So as I mentioned, we had 216 people who arrived to receive their medications for the exercise. we had 500 individual regimens or vials dispensed. So we're looking at about 2.5 per person, so households of approximately 2.5. We estimate our throughput to be 120 people per hour, although we noted throughout the exercise that the system wasn't really stressed. We didn't have a constant line of people going through. So I would safely estimate our throughput to be closer to 150 persons per hour. And then on average, it took 11 minutes for a person from start to end to work their way through the pod. And then also as part of our data collection, we sent out a survey to everyone who participated, and these are some of our qualitative results here. So 78% of the pod staff and 80% of pod clients said that they felt better prepared for a public health emergency after participating in the exercise, and 94% of pod staff said they better understood the capabilities and resources of the city. So even just from those two metrics, I think it was very successful that we're sharing information about what we do and why we do it. Next steps for me, it seems like the majority is done. I just have to write a final report that talks about our kind of successes and areas for improvement and submit that to the state. And that does have very set goals and objectives, including deadlines for us. So that's kind of the next thing that I'm working on here. And just very briefly, I wanted to mention our Medical Reserve Corps. So this is a group of volunteers interested in public health. They do not need to be medical people, despite the names, very confusing. But these are just people who are interested in health and want to try to volunteer and make the community a healthier place. And so we conduct trainings with them on a number of different topics. They volunteered for our exercise and do all kinds of fun stuff. So just wanted to put that information out there as well. We're always looking for new members and enthusiastic people to join us. So again, I just want to thank our partners, our volunteers, the other city departments. It made a very successful exercise. So thank you.
Thank you, Elizabeth. Can I just say one thing? Wally, for my upcoming ward meeting, could we have this information to give to folks? I don't want to ask Elizabeth to give up her evening, but I think this would be very useful.
My pleasure.
Thank you.
Thank you very much.
Okay, we're going down to HH7 and HH8 that we discussed partly before. And what's everyone's, Alderman Miller, Braithwaite, do we have anything else we want to say here?
Thank you, Alderman Fisk. In terms of HH7, where did the chief go?
He's here.
Okay. So they picked you to come in front of us for this one, huh?
Good evening, Madam Chair, members of the committee. James Pickett, our Deputy Chief of the Police Department.
So just a couple of things, Deputy Chief Pickett. And so when I was looking at this, it was a similar concern that I had with the medical marijuana, being able to look at the data in a way without straining my neck and make comparables. You were not here at the last Human Services meeting, so I'm not sure why you're up here now. The original request was to DC Parrott and looking at his specific unit. And so part of the President's initiative is calling for our police departments to look like our communities, right?
Okay.
And so think overall, our Evanston Police Department, under the city manager and also the chief, we do a great job with our overall demographics. Where my concern is specifically looking at the investigative services. And so it's taken us months to get here, and I think we're very close. I would like to be able, and I'm speaking to the chief because I know we've had this conversation before, I would like to be able to look at this data in a more comparative way, that we're able to read it in a way that it makes sense and a little bit more legible with all the information on the same page. I do, however, as we look sideways on this, and I don't know if you have the presentation.
You talk about specifically the investigations you're doing?
Yeah.
Okay.
And so it's hard for me to make that comparison. Like, I know just based on my PST interactions that there are more officers of color in PST. But then when I look at the other units, as I'm trying to turn sideways, I see a disparity in terms of the percentages. And so I can hold this till October and be more specific with.
If I may, Madam Chair, Alderman Braithwaite, we provide the information, and I think what I'm hearing from you is a dissatisfaction with the mix. So what we will try to do is we will continue to focus on the mix. I sent information out to the City Council yesterday saying that of police departments around the country, we could find only 2 in the United States of America that were more diverse on a ratio basis than the Evanston Police Department. We're committed to make sure that that is through every part of the Evanston Police Department. I think your point is that you want to see that consistently throughout all of the units, including the investigations unit.
That is correct.
And we will continue to work on that. And I don't know that there's additional information more that we can provide.
Well, I think in terms of seeing the statistics that are close together, and we can have this conversation offline, that would be number one, but part of the community concern. And again, this is a healthy conversation to have. There's nothing wrong with digging into this, given what's going on nationally. And so when I hear feedback from people of color within the community, the concern is always that who is policing us? And then when you look at the numbers, and it isn't evenly skewed, I think there's a reason for examination. And it's a challenge for all of us. It isn't just you, city manager, it isn't just Chief Edding. I mean, it's the whole community as a whole to be able to ask those tough questions. Why is it that there are more black officers just in PST and not across the board in the investigative services? And unfortunately, when I try to look at this graph, not only am I turning my head sideways, but I don't see it lined up in a way. So I can circle back with either you or the chief and get the information so we're able to digest it a little bit cleaner. And then from there, just like the medical marijuana, once we see the data in a way that makes sense and I'm able to track the trends, then we can take a closer look at what's going on.
And again, Alderman Braithwaite, members of the committee, I mean, the information is presented. We can walk through it. There's only so many groups that are here. The Field Patrol Bureau has 66% white, 19% African American. The Field Operations has 43% white, 43% African American. Field Operations Community Strategies, 23% white, 62% African American. White. Investigation Detective Bureau, 81% white, 19% African American. Investigation Juvenile Bureau, 64% white, 36% African American. Investigation Neighborhood Enforcement Team, 82% white, 18% African American. Tactical Unit, 80% white, 20% African American. Support Services Administration, 43% white, 57% African American. So that's it. I mean, those are the statistics. We are committed to make sure this police department reflects the community. With national statistics, there are 2 communities in the United States of America that are more reflective than Evanston Police Department. So we will continue to be, so we're the one out of the hundreds and hundreds of police departments in the United States. We will beat Honolulu, and we will beat, I forget the name of the community in Texas. But those are the 2 communities that the Brookings Institution says that are more diverse than the Evanston Police Department on a ratio basis. So we'll continue to work on that.
Again, I will make the request to be able to relook at the data. And the other request was to have Dr. Logan come and give a update in terms of the work that he's been doing.
And he will. His wife's about to give birth, and so that's the reason he's not here tonight.
So it would be good then to revisit this conversation maybe in October when we look at the other, what is that, HH?
But again, Madam Chair, members of the committee, please tell me what you'd like to relook at.
You just heard me. I don't want you to be defensive. I want you to be open to the conversation. You heard me make the request,
but I
and
don't
now
know what else.
you're ignoring my request.
But
and you're asking,
I don't know what more you want.
Okay,
If you'll tell me what more you want, we'll be happy to provide it.
We will definitely follow up then.
Okay. Again, we have one of the most diverse police departments in the United States. We're very, very proud of that. As the information I've just read to you, which Alderman Braithwaite requested, we will continue to work to make sure that every unit, I mean, most communities are so out of whack, are so disproportionate. We're so proud that we are where we are. But of course, this is Evanston, and we want to be even better, and we'll continue to work on that, Alderman Braithwaite.
Thank you.
So if there's additional information, Madam Chair, please tell me what that is. we can put it all on one sheet, and we're happy to do that, but I just read it off to you in 30 seconds' time. So I'm just frustrated, and I think Chief Eddington's frustrated. We still just don't understand what more you want from us.
Well, I share that because I'm not quite sure where we're going here.
We'll follow up. I can follow up directly.
But Alderman Fisk, I
okay.
really would request that the committee provide direction.
Okay.
I mean, we want to be thorough. We want to be complete. I've just read to you the information.
Right.
The information is here. There are national studies which prove that this department is about as diverse as you could ask for it to be. I think I understand Alderman Braithwaite's concern that he wants every division, every unit of the police department to have that same diversity, and we're committed to working on that. So if there's additional information beyond that, I would ask the committee to tell us.
I don't hear that. I don't hear that we need more information from that. But if Alderman Braithwaite believes we do, then I would suggest that he have a conversation with you. Does the rest of the committee feel that more information is needed, Alderman Tandem?
I think if more information is needed, it should be stated exactly now what we need.
Right.
Saying that you're going to follow up at another time or individually just makes that a less public meeting. So I would like to know right now what it is we need these folks to follow up with.
That's perfect. So I'll first start with the example of HH8, where I specifically asked we have the information in front of us, and I said, let's see it by percentages so that we can look at it by ward, by race, and by age. Now I can go through the spreadsheet. I think it's very simple to add that up. Alderman
Madam Chair, that's not the
Alderman
item that
Miller
the committee is
asked
discussing.
specifically for additional information. So again, the data is in front of us. It was a request to consolidate it in a different way.
Alderman
So
Braithwaite?
that's H8, right? And
Right.
there's no confusion there.
Right, but we're talking about HH7.
Right, and so now HH7, I'm saying the exact same thing. The information is there to be able to see it in a more condensed way, so I'm not looking at it crossway. So,
But
if
Alderman
there-
Braithwaite, it's here.
Yeah.
And we are when you look at the Field Operations Bureau, 66% white, 19% African American. Would we like to see that more balanced? Absolutely. Field Operations Traffic Bureau, 43% white, 43% African American. That's a good balance. Field Operation Community Strategies, 23% white, 62% African American. I think you're hearing that you're saying if that's not balanced, then we need to make a balance there.
City
Investigative
Manager,
Detective Bureau, 81% white, 19% African American. Should that have a greater balance? Absolutely.
Right, and I think, if I can just interrupt you for a minute, I think that's the question you're really asking tonight, is if the committee believes that it is, that goal should be a goal for the department. So I think that's the discussion point in front of us tonight. Yes. I think the information that you've presented is exactly what we all needed. I don't think it can be broken down any further than what you've presented. So I would put that to the committee. Is that a goal that you want to make for the police department?
I think that's an already understood goal.
And we'll continue to report it as regularly as the committee sees fit. I mean, clearly, we want to make sure that this is balanced, and the chief and I have these discussions. I mean, I would love to come back and talk about the zeros. We have a 10% Hispanic population, and when we look at the breakdown here, in the Investigative Detective Bureau, we have 0 Hispanics. And so I'm much more concerned about the Hispanic and Asian populations of the police department. We have an entire community where it is 0. So if you're a Latino or a Hispanic young man or young woman being dealt with by the police department, there are no officers that are Hispanic that are being dealt with you in that. That's the same is true in the Investigation Neighborhood Enforcement Team. The same is true in the Investigative Juvenile Bureau. The same is true in the Investigations Tactical Unit. The same is true in the Support Services Administration. And so those are concerns of mine as well, and that we need to have a balance among our Asian population and our Latino population as much as our Anglo and our African American population. And so this information has been before you. It's our goal to have this department represent the community that it serves. There are national studies which indicate that we not only do that, but we are among the highest of that ratio in the United States.
Can you explain how you reach out and attract the Latino population, for example?
Well, that's still done through recruiting, because we try to hit as many areas as we can, especially during the schools. Because like Western Illinois University, as an example, is a big law enforcement school, Illinois State University is the same. So we hit a widespread area. And one thing that I just wanted to make a mention of, as far as an officer going to a specialized unit, just so you guys can understand the process that we take, officer has to be on the job at least 3 years to get that experience off the street and really patrol. And one of the things that we try to do is officers, whatever their interests are, they put in for it. You have officers who want to be in community service. You have officers who want to be detectives, officers who want to be juvenile investigators. So we take that into consideration. The department doesn't say, okay, you're going to be a detective. You have to have an interest. So that's one of the things that the department tries to do. And they also have an interview process. And then we create a list. Unfortunately, it's a smaller department. It's considered a medium-sized department nationwide, but it's still really a small department. And a lot of times you don't have that movement. So you may have a detective that's in the detective bureau for 4 or 5 years. So you have a guy who puts in for detective. He may have to wait. He or she may have to wait. So I just wanted to explain how that process is. It is an interview process. If we don't have any, if you're not, I mean, we have guys, 15, 20-year veterans who love patrol. There's a 20-year veteran who has never put in for anything else. He wants to be in patrol. That's what he likes. He's a very experienced officer, and I even tried to encourage him to apply for a specialized unit. But a lot of people are comfortable in a particular position. So I just wanted to explain that part of it.
And I guess I would feel, and the committee members can share their opinion on that, but I think that's a very important point that you're making. And but I do think that we assume, as Alderman Tendam said, that the demographic representation in all areas is something, is a goal that you're working on.
Right.
But that's not always possible. I mean, I would never want to say to a police officer who's working in one area that because we need to fill a goal in this other area that you have to leave your patrol that you may have been on for 20 years and you love. So I think that's very, very useful.
Yeah, I just wanted to make that point.
Yeah. How do we recruit? I mean, do we, how does that happen?
We have officers in our recruitment department, and they go out. Like I was mentioning, and the reason why I mentioned Western Illinois University for selfish reasons, actually, that's a big law enforcement school. They have a job fair, a law enforcement career day. So, we'll send officers out, we'll set up a booth, we have the information about the job, the
and you tell them
requirements.
how wonderful Evanston is.
Exactly.
Yeah.
And so that's some of the things we do, and we put it out there as much as we can.
Okay, and anybody else, any other comments? On HH7 or HH8, should we go on to that? Okay, we're good with that?
Okay, thank you.
Oh, thank you so much. Are there any items for communication?
No, Madam Chair.
Then is there a motion to adjourn? Okay, we're adjourned. Rules Committee is going to begin in 5 minutes.